Let's go inside the injuries now with Dr. El-Amin and also, of course, Andrew Lalage.
Yes, of course.
Of course, you.
There'll be a lot of injuries to talk about. I mean, it's almost halfway in the season, so let's get started. So we got Greg Olsen, Jones fracture in week 2, placed on injured reserve, eligible to return this week. We don't expect him to be anywhere near where he needs to be until 3 weeks from now. Kelvin Benjamin, high injury risk before this last game, suffered a pretty bad right knee injury. No ligament damage, however, still probably dealing with some sort of bone contusion. Robert Woods, he had a grade 3 shoulder injury, but now it looks like it's been upgraded to a grade 2. Optimal recovery time for this injury is 2 to 3 weeks, so we should expect him back around week 15. Cam Chancellor, safety for the Seahawks. He's likely going to miss the rest of the season. He has initially a stinger injury. However, a neck injury is likely a disc injury to his neck, which is pretty significant, and he's likely going to be back for training camp next year. Now, let's talk about concussions. I mean, there's been recently a breakthrough type of study that's been happening at the NFL.
As you guys know, no one really wants to talk about concussions, but concussions are pretty bad. We know we got 2 key players right now that are on concussion protocol. There's one, Dante Freeman, and Phillip Rivers. So the question becomes, what is a concussion? We know that a concussion typically is an injury to the brain where some people say there's a change in the actual chemical pathways of the brain. But however, a study came out by Dr. Amalu, who actually showed that they've actually been able to, for the first time, identify the CTE protein in a live individual.
Wow. So usually they find this in people that have already passed.
Exactly.
But however, now they can detect it potentially within a live human being, which is a huge step forward in the diagnosis of this
And not only is it a step forward, but it's going to allow us to be able to manage it better, be able to look at these athletes and know exactly what's going on, when, and basically be able to give them a better life after football.
Yeah, neurological injuries from concussions are a pretty big deal, so this is a pretty big breakthrough.
Always been a mysterious injury.
Yeah.
Now, a little less mysterious now in terms of treatment.
Yep.
That's good. That's good medical news.
Yeah, congratulations.
All right, thanks to both of you. And we'll be back with more of Football's Play to Win right after this.